Urgent stroke warning 2. Silent causes and how to respond. Immediately. Stroke is one of the most dangerous medical emergencies today, not just in the United States, but around the world. It remains one of the leading causes of death and long-term disability, especially among older adults. When a stroke strikes, it doesn't just change the life of the patient. It can place a tremendous emotional, financial, and caregiving burden on the entire family. But here's the good news. If we understand how strokes happen and act quickly, we can dramatically reduce the severity of the outcome. In fact, taking the right action within the first few minutes can literally save a life or help someone recover fully instead of facing permanent disability. In today's article, we'll take a deeper look at stroke. What exactly happens in the brain when a stroke begins? And why does it occur? Most importantly, how can we spot the earliest warning signs, such as a slight facial droop, slurred speech, or sudden weakness in the arm or leg, signs that may appear briefly and be easy to miss? Well, also, walk through what to do immediately if you suspect someone is having a stroke, because every minute of delay increases brain damage and decreases the chances of recovery. In addition, you'll learn simple but powerful steps to prevent stroke. From managing blood pressure and reducing stress to improving your diet and recognizing personal risk factors. Small changes can have a big impact. Whether you're learning this for yourself or for the care of an aging loved one, the knowledge in this article will give you the confidence to respond effectively in one of the most time-critical medical situations. Remember, when it comes to stroke, speed is everything. A fast response can be the difference between full recovery and a lifetime of disability, or worse. 1. What is a stroke? Clearing up. Misunderstandings about a brain attack. Your brain needs a steady flow of oxygen-rich blood to function properly. A stroke, sometimes called a brain attack, happens when that blood flow is suddenly disrupted or when a blood vessel in the brain bursts, cutting off oxygen and nutrients to brain cells. Within just a few minutes, brain cells begin to suffer serious damage or die, and the damage can be permanent if not treated right away. There are two main types of stroke you should know about. Ischemic stroke. This is the most common type, accounting for about 80 to 85% of all strokes. It occurs when a blood vessel that supplies the brain becomes blocked, usually by a blood clot or a buildup of plaque. These clots may form directly in the brain or travel from another part of the body, such as the heart, in cases of atrial fibrillation, and get lodged in a brain artery, cutting off circulation. Hemorrhagic stroke. This type is less common but usually more severe. It happens when a blood vessel in the brain ruptures, causing bleeding into the brain tissue or the areas around the brain. Common causes include long-term high blood pressure or abnormalities in blood vessels, such as aneurysms or arteriovenous malformations, AVMs. The escaping blood builds up pressure and damages nearby brain cells. No matter the type, stroke damages brain tissue rapidly, and the severity depends on which part of the brain is affected. Understanding these two types is the first step to recognizing the signs and responding in time. 2. How to recognize a stroke. Remember the be fast rule. When it comes to stroke, time is critical. With each passing minute without medical intervention, millions of brain cells can suffer irreversible damage. That's why recognizing the early signs of stroke can mean the difference between full recovery and permanent disability. One simple but highly effective way to remember the warning signs of stroke is through the acronym Be Fast, Be Balance. Sudden loss of balance, dizziness, or trouble standing and walking steadily. EIs. Sudden changes in vision. Blurred vision, double vision, or loss of sight in one eye. F. Face. One side of the face may droop or feel numb. Ask the person to smile if one side doesn't lift. It's a warning sign. arms weakness or numbness in one arm or leg. Ask them to raise both arms. If one arm drifts downward, it may be a stroke. Speech. Slurred speech, trouble speaking clearly, or difficulty understanding others. Ask them to repeat a simple sentence to check. Time. If you notice any of these signs, don't wait. Call 911 immediately. Time is brain, and be sure to note when the symptoms started. Many stroke symptoms come on suddenly and often affect just one side of the body. There are also cases known as TIA, transient ischemic attack, where stroke-like symptoms appear briefly and then disappear within minutes or hours. While TIAs don't cause lasting damage, they are a serious warning sign that a full stroke may be imminent. Anyone who experiences a TIA should seek immediate medical evaluation. 3. What to do if you suspect someone is having a stroke. Every second counts. If you think someone might be having a stroke, acting fast and correctly can save their life, or at the very least help prevent severe and permanent brain damage. What to do immediately. Call 911 or your local emergency number without delay. This is the most important step. Don't wait for the symptoms to become more obvious. Position the person comfortably. If they're already lying down, turn them onto their side, especially if they feel nauseous. This helps reduce the risk of choking. Loosen any tight clothing. Make sure nothing is restricting their breathing or blood circulation. Note the time symptoms began. Try to remember or write down exactly when the first signs appeared. This information is crucial for emergency responders and doctors. Keep the person calm. Speak in a reassuring voice and help them stay relaxed. Panic can make things worse. What not to do. Do not give them food or drink. A stroke may impair swallowing and increase the risk of choking. Do not give any medication, including aspirin or blood thinners. If the stroke is caused by bleeding in the brain, these drugs can make it worse. Do not drive them to the hospital yourself unless there's absolutely no other option. Paramedics can start treatment on the way and are trained for emergencies. Do not wait to see if they improve, and do not use unverified home remedies. Every minute of delay increases the risk of permanent brain damage. 4. The golden hour. A critical window in stroke treatment. When treating a stroke, especially an ischemic stroke, time is absolutely critical. Medical professionals refer to this as the golden hour, the ideal window for effective intervention, typically within 3 to 4.5 hours from the first signs of stroke. In some advanced medical centers, newer technologies may extend this window, but the rule remains the sooner the better. If a patient reaches a stroke-ready hospital during this golden window, they may qualify for treatments such as clot-busting medication, such as TPA. This drug helps dissolve the blood clot and restore blood flow to the brain. Mechanical thrombectomy. A procedure in which doctors thread a small catheter into the blood vessels and physically remove the clot from the brain. The earlier the treatment, the lower the risk of brain damage. Timely care greatly improves the chances of recovering movement, speech, and cognitive function, and reduces the likelihood of long-term disability. 5. Stroke risk factors. Are you in a high-risk group? Knowing what raises your risk for stroke is the first and most important step in prevention. Risk factors you can control. High blood pressure. The #1 cause of stroke. Proper management can significantly lower your risk. Diabetes damages blood vessels and increases the risk of atherosclerosis. Plaque buildup. High cholesterol contributes to narrowed arteries and restricted blood flow. Smoking increases the risk of blood clots and weakens blood vessel walls. Excessive alcohol intake, overweight and obesity. Lack of physical activity, heart disease. Especially atrial fibrillation, which can cause blood clots in the heart that may travel to the brain. previous stroke or transient ischemic attack. TIA. Having had one increases the risk of a second stroke. Risk factors you can't change but should be aware of. Age stroke risk increases significantly after age 55. Family history. If your parents or siblings have had a stroke, your risk is higher. Gender men are more likely to have a stroke at a younger age, but women, especially older women, are more likely to die from one. 6. Proactively preventing stroke. What you do today shapes your health tomorrow. The good news is that up to 80% of strokes can be prevented by managing risk factors and maintaining a healthy lifestyle. Here are practical strategies you can start right away. Eat smarter. Reduce salt intake. The WHO recommends adults limit sodium to no more than 5 grams per day. Avoid saturated fats and trans fats, which are commonly found in fast food fried items and processed red meats. Increase your intake of fresh vegetables and fruits. Whole grains and healthy proteins, especially omega-3 rich fish, like salmon or mackerel. Consider following the DASH or Mediterranean diet, both proven to support heart and brain health. Stay physically active. Aim for at least 150 minutes of moderate activity per week, such as brisk walking, swimming, or biking, tailored to your personal ability. Maintain a healthy weight. Obesity significantly increases stroke risk. Managing weight helps control blood pressure. Cholesterol and blood sugar. Say no to smoking. If you smoke, seek help to quit. Also, avoid secondhand smoke, which can be just as harmful. Limit alcohol. If you drink, do so in moderation and follow medical guidelines. Get regular checkups. Don't wait for symptoms. Monitor your blood pressure. Blood sugar and cholesterol regularly, especially if you're over 50. Follow your treatment plan. If you have underlying conditions such as high blood pressure, diabetes, high cholesterol, or heart disease, take your medications as prescribed and keep up with follow-up visits. 7. Stroke recovery. A journey that requires patience and support. For those who have experienced a stroke, rehabilitation is a vital part of recovery. This process takes time and the support of a multidisciplinary team, including physical therapists, to help regain movement and balance. Occupational therapists to assist with relearning daily living skills. Speech-language pathologists to restore speech swallowing and communication abilities. The goal is to help stroke survivors regain independence, improve quality of life, and reduce the burden on caregivers and families. Stroke is a true medical emergency. Knowing the signs using the Be Fast method, calling 911 immediately, and making lifestyle changes are key steps in lowering death rates and long-term complications. Please share this information with your loved ones and friends. Knowledge is power, and it could help protect the people you care about from one of the most serious health threats. Thank you for reading and for taking an active role in your health.